Warm welcome to all of you. This time let's discuss the 11th nerve first, and let's see if the time is left. We'll also do the 12th nerve, that is hypoglossal. So 11th nerve, in the 11th nerve it's called the spinal accessory, but there is also a cranial accessory component of it. So first let's have a look at the cranial accessory nerve first. Yep. So this is cranial accessory nerve. It comes from where? It comes from the nucleus ambiguous. It comes from the nucleus ambiguous in the medulla. From here arises this red colored is the cranial accessory part of the accessory nerve. One is a cranial accessory, one is a spinal accessory. So this is cranial accessory, which is arising from the nucleus ambiguous. After that, it passes through, we know this, 9th, 10th and 11th nerve, they pass through the jugular foramen. So this red colored fibers, they will also pass through the jugular foramen, and then along with the vagus, this black colored thing is vagus. Along with the vagus, it will form the vagoaccessory complex, and or also called as the pharyngeal plexus, the vagoaccessory complex or pharyngeal plexus, in order to supply the muscles of the pharyngeal plexus. That means for muscles of the pharynx as well as muscles of the palate. Okay. So I hope this point is clear. Right. Now coming to the spinal accessory. So you have your cervical levels starting now in the spinal cord, C1, C2, C3, 4 and 5. These components, these spinal segments. What happens? There is a spinal accessory nerve which is coming. First there is individual rootlets which are coming, and then they all combine together to form this spinal accessory nerve. It first passes out of the spinal cord via the foramen magnum. This foramen magnum, it will first go out through the foramen magnum, and then through the jugular foramen it will again go downwards and in the neck, in the posterior triangle of the neck, and then it will supply the sternocleidomastoid and the trapezius muscles. So this is how these things work. So both the components of spine of the accessory nerve, that is cranial component as well as spinal component, both of them they pass through the jugular foramen along with the other two nerves, 9th and 10th. So 9th, 10th and 11th, both components of 11, they will pass through the jugular foramen, but cranial component will only and only pass through this JF, whereas the spinal component will first come out by the foramen magnum, and then again it will enter into this jugular foramen and supply only two muscles, that is SCM and trapezius. And the cranial accessory, it supplies a hell lot of muscles because it forms the vagoaccessory complex or the pharyngeal plexus to supply various muscles of the pharynx, the palate, etc. Okay, so that is 11th nerve. And here we also have the 12th nerve. The 12th nerve is the hypoglossal nerve. It will also arise from the medulla. The nucleus is present, and here you have the foramen, that is a hypoglossal canal through which it passes. Now this supplies all the muscles of the tongue. So hypoglossal, so it is related with the glossi, that is the tongue, except for one, that is a palatoglossal, because the word palate has come, that means it is already a muscle of the palate as well. And so if a muscle of the palate, which implies it is being supplied by the vagoaccessory complex, the 10th nerve, via the cranial accessory. After that, here you have the various segments such as C1, C2 and C3. So C1, from C1, see this branch comes, it runs for some time along with the hypoglossal nerve. So it is said that the C1 via the hypoglossal, the C1 nerve via the hypoglossal nerve supplies two muscles. One is geniohyoid and one is thyrohyoid. So geniohyoid and thyrohyoid. Out of these, which one do you think is a strap muscle? It is a thyroid, because geniohyoid has to do with the mandible. So mandible is still above the neck. So the strap muscle of the neck, one of them over here is, we covered, thyrohyoid. Other strap muscles of the neck, how will they be supplied? They are supplied, as we all know, by the classical ansa cervicalis. And how was it formed? C2 and C3, these components, they give a combined nerve that is called descendant cervicalis, and from the C1 descends down nerve, and that is called the descendants hypoglossoi, and from there, unification, from their means where they meet, where they unify, from there we have three offsets. One is ST, SH and OH. So ST, SH and OH, ST, SH and OH. So it's just like, shout. It's just like shout, because that is how you have to learn it. It's just like shout. Is it the correct spelling? SHO. Yeah, it's the correct spelling. So one is SH, then one is OH, and then one is ST. So you have to remember like that, right? So remember the word shout. So one is SH, one is HO, that means OH actually, and one is ST. One is ST. Okay? SH, OH, and ST. So the stylothyroid, stylohyoid, and the omohyoid. So all these three, they are also again the strap muscles of the neck. So they are being supplied by the ansa cervicalis. Whereas the geniohyoid and thyroid, which we discussed before also, they are supplied by C1 via the hypoglossal nerve. So if they ask you a question that which is the only strap muscle which is not supplied by the answer, obviously it is thyroid. It's simply supplied by C1, not the answer. C1 via the hypoglossal nerve. The fibers of C1, they will run along with the hypoglossal nerve. Geniohyoid, it's not a strap muscle. Now certain exceptions. This is so high yield and so important. Exceptions. Number one, all the muscles of the tongue. Now, please, without looking on the screen, you first tell me the answer. All the muscles of the tongue are supplied by dash nerve. Yes. Tell me. They are supplied by the hypoglossal nerve, that is the 12th nerve. Okay, all the muscles of the tongue are supplied by the 12th nerve, hypoglossal nerve. Do you remember any exception we discussed? We have discussed this already. The palatoglossus, because it is also having the component P, that is palate component, so it will be supplied by the vago accessory complex like the other muscles of the palate. Good. Now tell me about the palate. All the muscles of the palate are primarily supplied by the vago accessory complex, but there is one exception, that is the tensor of the palate, tensor villi palatini. It is supplied, both the tensor villi palatini, tensor villi palatini, as well as the tensor tympani. They are supplied by the nerve to the medial pterygoid. That is the division, that is the branch of the 5-3, that is mandibular nerve. Okay. Now larynx, all the muscles of the larynx are supplied by the recurrent laryngeal nerve. Is there any example? Yes, there is an external muscle of the larynx, cricothyroid muscle. Cricothyroid muscle. It is supplied by the external laryngeal nerve. This was easy. Come on, this was easy. Even this was easy, and even this was easy. Nothing is difficult. You just have to revise it once and twice more. Now pharynx, all the muscles of the pharynx are supplied by the vago accessory complex. Here there are two exceptions in case of pharynx. One is the stylish one, the stylopharyngeus, and one is the quiet one, that is the cricopharyngeus. So stylopharyngeus is supplied by the 9th nerve, that is glossopharyngeal nerve, and cricopharyngeus, it's supplied by the recurrent laryngeal nerve. So that was all for this lecture. Thanks a lot for watching. Please do like, subscribe, share, and comment.